Hey guys, it's Phil here, Doctor of Physical Therapy. Today we will be talking about hip pain playing pickleball. We're going to go into the different types of hip pain and what you can do to address it. Hip pain is very common in the general public, but especially with playing pickleball because of the amount of lateral movements and lunging that you have to do. Sometimes playing pickleball can actually exacerbate some of your hip pain. Meaning, maybe you've had some type of hip injury in the past and playing pickleball actually worsens it. First, we're going to go over all the common types of hip injuries. But before we dive into it, we first have to acknowledge that every injury is different and everybody's different. So it's hard to give a general blanket solution to all hip injuries. But there are some commonalities with all hip injuries, so that's what we'll focus on in this video. First, we're going to talk about hip strains. A strain is basically a muscle that's been overworked. Muscles are like rubber bands. For example, when you're doing a bicep curl, you're shortening the muscle and then you're lengthening. So sometimes, especially if you're moving around a lot, doing quick sprints, sometimes your muscles can be a little overtaxed, and that can lead to some soreness in the next couple days. Strains are very common and they're relatively less serious. So some common muscles that can be strained with pickleball are your hip flexors muscles, which is the muscle that's right in front of your hip in charge of lifting your knee up, or this outer side of your hip, kind of this lateral corner. This is called the TFL, or sometimes it can be your hamstrings into your glute area. So it really depends on the type of movement that you did that may have triggered your pain, but they're relatively straightforward and people do really well with just some rest and some strengthening afterwards. Next, we're going to talk about some labral issues. So typically this occurs in people younger than the age of 50. Basically, there is a ligamentous tissue. So there's like this ligament type tissue that is a part of your hip joint. So your hip is basically your thigh bone, so your femur connected to your hip socket. There's an extra bit of tissue called the labrum that basically helps to deepen the socket, make it more secure, and gives the joint some more stability. And sometimes this tissue can get aggravated or even torn, and that can lead to some symptoms. However, a lot of studies have actually shown that you can find labral tears or labral degeneration in a lot of people without hip pain. So it's very possible to have some structural changes but have no pain. So the typical presentation if you have some type of hip labral issue is the inability to extend. So you have trouble bringing your leg back. When you do that, you might experience some pain in the front of your hip. So you feel like you want to like kind of hunch over and protect that hip. You might have some clicking around the joint when you put weight on it or when you twist it around, or it may be really painful when you kind of put too much weight on your leg. Next, we're going to talk about FAI. What this means is femoral acetabular impingement. Basically what it is some people, based on their anatomies, have an extra bump on their thigh bone, or their hip socket is extra deep, and that can cause some pinching at the hip when you kind of raise your leg up. This is also more common in people under the age of 50. Basically when you lift your knee really high up, or if you do a lot of activity in like a really bent position, that can trigger some achiness at the lateral front of your hip. And lastly, we have osteoarthritis. So this is something that we all get as we age. So this is more common in people over the age of 50, but actually a lot of people have it, but they don't even know it because it's not symptomatic. So that really depends on your genetics and a lot of other factors. We sometimes like to call arthritis as wrinkles on the inside. With arthritis, people typically have more dull, achy pain in the mornings, and it may take some time to warm up. You may have difficulty lifting your leg out of a car, or you may have trouble lifting your leg up into your bed. And it typically hurts more after a long day of activity. Now that you might have a better idea of what you're dealing with, we're going to go over how do you manage your condition. So with hip strains, a lot of times it's due to an overworked muscle. So you want to just take it easy for the next 1 or 2 weeks, and typically things heal up pretty quickly. You want to do you can lay off on playing intense pickleball games, but maybe you can do some light dinking and add in some rehab exercises to start waking up and building those muscles. Next, if you think you have some hip labral issues, it's important to avoid too much hip extension, so too much opening of the hip, and to avoid too much twisting at your hip. because that can actually aggravate the labrum further, which is what you don't want to do. So don't do a lot of hip opening stretches if that's aggravating. Now for FAI or impingement, because the aggravating factor is bringing your knee up, it's important to avoid too much of that. So too much hip flexion and rotating while the hip is flexed. So for osteoarthritis, it's all about managing your loads, because this is kind of like a long-term diagnosis. You have to find a balance of activity versus rest so you don't aggravate your hip. So be mindful of how much time you're spending on your feet and listen to your body. And the number one thing for hip arthritis is strengthening the muscles around the hip so that it can help take some load off of the joint. So here comes the fun part, the actual rehab programming. The beauty of rehab is, even though you may be dealing with a lot of different diagnoses or different conditions, the actual rehab part of it actually can look pretty similar. Because you can only move your leg in so many directions, there are only so many exercises that you can do. So somebody dealing with a hip labral issue can be doing the same exact exercises as somebody dealing with hip arthritis. So the way you manage the conditions is different, but the actual rehab part can actually be very similar. And at the end of the day, you can't go wrong getting strong. So before we dive further into the exercises, I first want to set some ground rules. There will be 5 exercise categories, and you want to pick one that is suitable for you from each category. Perform 3 sets of 10 to 15. So we're just going to structure the exercise program from the easiest exercise to the hardest exercise for each movement. You want to pick something that's moderately challenging, but not too hard. And if something feels too easy, like you can do sets of 20 or 30 without much difficulty, then try moving on to the next exercise. And if it's a holding exercise, so a holding exercise means you're not really moving, like a plank, also known as an isometric exercise, then try to aim for 20 to 40 seconds. And you want to do the entire program for 3 times a week. So something like every other day is a great place to start. So the first movement is hip flexion. So what we're working on is basically lifting your leg up towards your chest. So we're going to do a hip isometric exercise. So what that looks like is you're going to lie on your back, lift your knee up, and press into your. So this is a holding exercise, meaning you're not really moving, but I'm pushing my knee into my hands for 20 to 40 seconds. What this does is it activates the front of your hip, and it's going to help strengthen your hip flexor muscle. Next, we have the supine march. So what this looks like is you're going to be on your back, knees bent. You're going to tighten up your core, keep your lower back flat against the ground, and you're going to march your knees up one at a time. You should feel this a little bit in the front of your hips and also in your core. Straight leg raise. What this looks like is you're going to be on your back. You're going to straighten one leg. The other leg can be bent like so. Tighten up your leg, your quad, keeping your toes pointing towards the sky. You're going to lift your entire leg up and down, just like that. Next, we have what's called a dead bug. So what this looks like is you're going to be on your back, hands and knees pointing straight towards the sky, keeping your back flat against the ground. You're going to lower one arm and the opposite leg. So you should keep your core engaged, keep your lower back flat against the ground, just like that. To progress the dead bug, what you can do is put a band around your feet, just like so. Same exact thing, hands and knees pointing towards the sky. Lower one arm and the opposite leg at the same time. So this will just give you some more resistance at your hips. So next we're going to do a march with a band. So you're going to grab a resistance band, put it around your feet, stand nice and tall, and you're going to march by bringing your knee up and while keeping the standing leg super straight. You should feel this in the front of your hip and also in the glute of the standing leg. The next movement is called hip extension. What it is basically when you're opening up your hip. So instead of bending with hip flexion, hip extension is opening up. So I'm opening up my hips. First exercise, glute bridge. So you're going to lie on your back, knees bent, and you're going to press your heels into the ground Squeeze your glute muscles and bridge up and down, just like that. Next, we got the 2 up, 1 down glute bridge. So what this looks like is you're gonna bridge up with both legs. You're gonna lift a leg up and come down with one. So 2 up, lift one leg up, come down with one, just like that. Next, we have the single leg bridge. So what this looks like is you're gonna lift one knee up towards the sky, heel press down into the ground, and you're gonna bridge up towards the sky, just like that. You should feel it in the glute area. And if that's too easy, you can do a straight leg raise version of the single leg glute bridge. So basically you're gonna lift one leg up and you're gonna keep it there, and then you're gonna bridge up towards the sky, lift your bottom up while keeping the other leg up in the air. We've got hip abduction next. What this means is basically whenever you're moving your leg out to the side. So this strengthens the lateral or outer aspect of your hip. So the first exercise is the clamshell exercise. So you're gonna be on your side, knees together and feet together. And what you're gonna do is just to open up your knees, and you should feel it at the outer hip area. And if that's too easy, you can put a band around your knees and you can do the same thing. And to take it up a level, what you can do is what's called a side plank on your knees. So you're going to have an elbow down on the ground and knees together. You're going to lift your bottom up and you're going to reach towards the sky and just hold this. Next, you can also do a side lying hip abduction. So you're going to be on your side, bottom knee is bent, top leg is straight, and you're just going to lift that entire leg up towards the sky, just like that. And you should feel it at the outer hip area. Next, we have the lateral band walk. So you're going to put the band just above your knees. You're going to get into a squat, so butt back, knees bent, and you're going to take some side steps, just like so. You want to maintain that knee bend and that hip bend while you're doing this. And the steps aren't very big, but you should feel it in your outer hip area. And if you want to make this harder, you can lower the band towards your ankles, and that's just going to add some more resistance. And if you want to make it even harder, what you can do is do a full side plank. So whole body straight from head to toe, and you're going to be on your elbow and lift your hips up towards the sky and just hold. And the last movement is called hip adduction. So what this is basically working on your ability to bring your knee in. So you're working on your inner groin muscles. The first exercise is called Adduction isometric. So I'm going to use a pillow. You can use any type of cushion or towel. Basically, you're going to be lying on the ground. You're going to put the pillow or towel in between your knees, and all you're going to do is just squeeze the pillow. So I'm squeezing. I should feel it in my groin area. I'm going to hold that for 20 to 40 seconds and relax, getting some activation in that groin muscle area. Next, we have the hip adduction plank. So this is a little bit tricky. So you're going to go on your elbow, on your side, and the bottom leg is going to be bent, top leg straight, and you're going to lift your hips up from the ground. And what you're actually going to do is actually actively press that foot into the ground. So I'm pressing this foot, my right foot, into the ground, and I should feel it in my inner groin area on that side. And next what you can do is called an adduction straight leg raise. So basically what this is you're going to be on your side, you're going to cross your top leg over, so you're going to work the bottom leg. And what you're going to do is you're going to lift your bottom leg up off of the ground. And you should feel that in that inner groin area. And if you want to make it even harder, you can grab a chair, put your knee on top of the chair, on your elbow, and what I'm going to do is bridge up from the ground and try to maintain this position. You should feel it in your inner groin on both legs actually. And you're just going to hold this. Next we have the lateral lunge, so you can get nice and wide. And you're going to sit towards one hip and then sit down towards your other hip. Just like so. Keeping your back straight, you're going to sit down one way and then the other way. And if you want to spice it up even more, you can use a slider. If you don't have a slider, you can just use a towel or wear socks on hardwood floors. That would work too. So I'm going to put my slider down. I'm going to slide out one way and I'm going to bring it back. Slide out, get into a little squat, and bring it back. So as I'm pulling that back, I should feel it in my inner groin on that side. The last category of exercises, we're going to talk about compound movements, so bigger movements. We're going to start with a step up, so you have access to a step or stairs. What you're going to do is just going to bring one leg up, you're going to step up and come down. Up and down. Up and down. Next, we're going to do some squats. You're going to get your feet about shoulder width apart, feet slightly turned out. You're going to slowly sit down into your hips and come back up. So squat down and come back up. And if this bothers you, you don't have to go as low, but you do want to keep your back straight, chest up, just like that. Next, we're going to do a lunge. You're going to get nice and long, right? And then you're going to lower yourself towards the ground in a nice and controlled manner. Lastly, we're going to do a deadlift. So what you're going to do is put a weight between your legs. So I have a kettlebell here right between my legs. If you don't have a kettlebell, you can use a dumbbell as well. You're going to bend down from your hips. So I'm bending mostly from my waist. Knees are slightly bent. I'm going to reach down, grab the weight, and lift up. So with these compound movements, the nice thing is you can always add weight to it to make it harder. So with the step up, with the squat, with the deadlifts, use some weights to make it more challenging for you so you can get your hips as strong as possible. So to wrap it up, it's important to understand what triggers your pain. And especially when something is injured, you don't want to keep aggravating it. Then you want to find a way to strengthen around the injury, around the joint to support it better. Get it stronger, and it's going to build more resilience and help you become a stronger athlete. So I hope you learned something from this video, and take care.